a early 40s female with watery and sometimes bloody vaginal discharge for the past 4 or 5 years. She was not from the US. She'd been worked up abroad somewhere. She'd had a, actually, let's just look at the MR images first. So she has this very complex cystic looking mass occupying nearly the entire the cervix, and then there's a single nabothian cyst further inferiorly. On the axial T2, we can see that the T2 hypointense ring, it's entirely intact. And as far as finding solid components, it was difficult, but there's just this one area that showed some mild hyperenhancement, and it showed some restricted diffusion within it. So I don't have more images. I have the path report after this. She was, as I was saying, she was worked up outside of this country for a question fistula, which came back negative. And then when she came here, the first time she had an in-office biopsy, it came back negative. So they did a cone biopsy under anesthesia.
Can you go back to the other slide?
So we do have a number of guesses here, and everybody's going for adenoma malignum. Susan Asher, though, asked, was it watery discharge or whitish?
So it was reported as watery.
Okay. Susan, what would the whitish help you differentiate?
I don't know.
I'll see if Susan types in. But go ahead. Nilly wanted to see something.
Can you go to the prior slide? Because the capsule doesn't totally look normal, like right there at 7 o'clock.
At 7 o'clock, right? Yeah. So I was looking at that, but I think that was just some volume averaging, because it was reported as complete also, and scrolling up and down it did. But this was the largest extent of it, so I chose this slice to show here.
Okay, gotcha.
Yeah. But yes, everybody's guess is correct. So it's a really nice textbook case. And so pathology basically showed mucinous gastric type endocervical adenocarcinoma in a background of very florid glandular hyperplasia with gastric pyloric type. And just little tidbits on it that it's also known as minimal deviation adenocarcinoma. And it's very, very rare, only accounts for 1 to 3% of all cervical adenocarcinomas. It's usually HPV negative, which so HPV negatives usually account for 10% of cervical adenocarcinomas. And this is right within the average range of presentation, and it's associated with Peutz-Jeghers syndrome. And the only other differential that we were really thinking here was tunnel clusters, but they had a biopsy, honestly, before we saw these images. So, but yeah, it was a nice.
We've had some cases of tunnel cluster, like a ton of nabothian cysts, and then we kind of think like, could this be adenoma malignum? And then we'll be like, okay, well that's really rare. Nabothian cysts are really common, so we probably shouldn't, overcall it. But the watery discharge helps. And Susan says leukorrhea is a common symptom in this uncommon entity.
I see.